You are not broken. No matter what you've been told, no matter how you feel, you are not broken. And you can heal. You can heal.
Welcome to the Upside of Bipolar. I am your host, Michelle Reitinger, and I have a fantastic guest today. I'm so excited to introduce Janey Nelson to you. Janey is the owner and clinical director of Healthier You Counseling Center and has been a therapist for about 20 years. In 2024, she trained in critical memory integration, CMI, and is on the CMI training leadership team. Janey was one of the first accelerated resolution therapy, ART, practitioners in Utah, being trained in 2017 and master trained in 2019. One of her passions is helping others discover their best selves. She does this by creating healthy relationships with clients in individual, marriage, family, and group therapy. Janey helps facilitate empowerment retreats for women and couples. Due to marriage and family being so important to her, she runs Gottman and Layers of Love relationship groups. Additionally, Janey facilitates other groups as need arises. One of the things she is working on for the CMI team is developing CMI for groups. Her greatest belief is that it is important to love everyone, no matter the circumstances. She shows love by practicing kindness, which she believes is honest, assertive, respectful, and loving. It is this belief that helps Janey connect with her clients and develop bonds of trust that allow them to grow. To add to Janey's professional experience, she is a wife, mother, grandmother, and great-grandmother. She was a foster parent for more than 22 years, and during that time, she was awarded Utah's Child Advocate of the Year. Janey loves to cook, enjoys nature, quilting, jewelry making, stained glass, her new hobby, and many other hobbies. She finds peace as she creates. Janey practices mindfulness daily in each of these activities, and they keep her grounded and in touch with herself. Welcome, Janey. I'm so excited for this conversation today.
That's kind of fun. That's fun to hear that introduction again. I haven't read it for a minute.
Yeah, you're very well-rounded, and I'm super excited to dig into what you do. So thank you so much for coming on today. So we always start with your story. So will you please share your story with our audience?
Sure. My story goes back many years. I was 5 when I knew my job was to help others. But at 5, you don't know what that means, right? And so I always tried to do things. I was the friend that would show up and help with that. I helped my siblings a lot. I worked with my mom and dad, worked in my dad's office for a long time, but I don't know what help others mean. So when I was young, got married at 18, started raising kids. My husband said, you can't work outside the home. I said, okay. So I became a foster parent, and I took the structured kids, the kids who were one step away from being in resident. I did that for quite a few years. Well, I was about 40. My own children were struggling, my youngest, and I was talking to God one day, and he said, go to school. And I said, no. And he said, go to school. And I said, no. And he said, go to school. And I said, okay. And I went to college, and I did 0 college to my master's in 6 years exactly. And during that time, I had cancer twice, but I still completed in 6 years and just started doing the therapy thing. Well, I get a little bit older, and I've worked with residential. I worked with my best friend for a while, and I was talking to God, and he said, open a practice. I was almost 60. I'm thinking, why am I going to open a practice? So I said no, and he said, open a practice. And I said no, and he said, open a practice. And I said, okay, which is how Healthier You came about. So that's kind of the story that it's got me to this point. And Healthier You's been a journey in and of itself, a beautiful journey, one that I love and I'm grateful to be part of.
Yeah, I was so impressed when I looked at your clinic. I was looking at the website online, and you have some incredible practitioners there. And there's such a diversity of modalities too that I haven't seen. I'm sure that I'm not saying that there aren't other clinics out there, but I've never seen a clinic with the breadth of modality experience that you have with your practitioners. And I want to talk to you about the 2 that you specialize in. So the ART, accelerated resolution therapy. We have had one practitioner on before, but I'd like to hear your introduction to what ART is and how it facilitates healing. And then I want to explore the critical memory integration, because I have never had a practitioner on that does that. And you've got not just yourself, but you've got others in your clinic that practice that as well.
So our clinic is trauma proficient. So a lot of clinics are trauma informed, right? But all of us are in best practices of trauma. So back in 2017, I cook for fun, and I was asked to cook at a retreat with veterans. And So I'm just in the kitchen doing my thing, and where do men hang out? In the kitchen with the food. And every one of them talked to me about how ART had changed their life. So I went home to my best friend and I said, okay, I'm going to go learn this skill. She said, okay. And we went and we were trained in ART. And what it is for me, a trauma is not what happens to you. Trauma is how you think and feel about it. So ART, when you get trained in it, what you find is that we're reducing the emotions and sensations around the trauma. Well, trauma is now just a fact. It's nothing more than a fact. This happened to me at this time. ART is so powerful, we don't use it before a court case. So if a victim goes in and they just say, this happened to me and it's a fact and there's no emotion, juries don't believe them, right? So we can't remove the emotion right before a court case. But some of the most powerful experiences is helping someone. I work a lot with police and fire, watching them walk out of here with a trauma they've carried for years, and now it's not a big deal. We're talking 45 minutes to an hour and 15 minutes. That's it.
So how does that modality work? Can you explain? So I don't know if there's a way to explain it simply.
A lot of bilateral stimulation, and we take you out of the prefrontal cortex and put you back into your amygdala, right? Which is where we hold our emotions, our hormonal regulation. We take you out of the logic brain. We try and logic away everything. And as you use a bilateral stimulation, it's very scripted, and the clients don't have to tell me what they're working on. So a lot of times people don't want to talk because they don't want secondary trauma. They don't want to create trauma in the therapist. So I say, give me one sentence of what you're working on. It might be a car accident I saw. Great. That's all I need to know. I don't need to know more. And they don't have to share anything throughout. So it's bilateral stimulation. And then we erase and replace. So we erase the sensations and emotions and replace them with positive. We positize things that are negative in their life. And they get to do it.
That's incredible.
They get to do it.
Yeah.
It's so fascinating to watch. I just say, let's do this, and their brain will go there. It just goes there.
So I know that bilateral stimulation is similar to what is used in EMDR. So can you talk about what the difference is between those two modalities?
I am not an EMDR therapist, so that's going to be hard for me to tell you the difference from what my training, but I can tell you what I've been told. I've been told with EMDR, and I have seen this because my best friend is an EMDR therapist, is EMDR you can process for hours, days, months, years afterwards. You have a session and you process afterwards. What my clients have told me, what the therapists I've had that have been trained in both have told me is ART is EMDR on steroids. It's faster, it's quicker, it's less traumatizing to the client, it's less traumatizing to the therapist. So when you walk out of my office after an ART session, that issue is gone. It is resolved. Done. Can I share an experience of that?
Yeah, I'd love to hear that. Yeah.
The first officer I did it on, who had his body cam on the whole time and I didn't realize it, right? His first officer, he was an officer for 20-something years, but his first officer-involved shooting was in Orem, and every time he drove down the street, he got nauseous and ready to throw. That memory of that officer-involved shooting. So I did an ART session on that for him. He came in the next time, he said, what did you do to me? And I said, what do you mean, what did I do to you? And he said, I was on that street and I didn't even realize. No more nausea, no more anxiety driving down the same street. One session.
That's incredible. I wish I'd known that before I'd done the EMDR. And I don't want to bag EMDR. It was a huge blessing for me, but it was like a month and a half of like serious trauma because I was reprocessing everything and it felt like I was back in the experience for a month and a half. It was a very distressing experience.
So because EMDR focuses on a emotion, we focus on the whole thing from start to finish. And we actually, at the very end of ART, we have them visualize their future. What does your future look like with this gone? Right? And that's powerful. It's like, wait, I can enjoy my kids now. I can drive down the street I couldn't drive down before. I don't have to drink as much.
Yeah.
Like we get all kinds of things that are just beautiful. It's beautiful.
Yeah, that's incredible. So I want to shift to critical memory integration because I've never had anybody, I will be honest, I've read about it, but I don't really understand it. So I would love for you to explain what critical memory integration is and how it is used in your practice.
Okay. So we talk about trauma and ART. So here's the trauma experience. Why can one person see the same car accident as someone else and this one's traumatized and this one isn't? Does that make sense? We're asking all the time, how come many people can go through the same trauma and it affects some people in one way and some people in another? So critical memory integration actually to me is why that affects you. So trauma, this experience happened. Why am I reacting to it? And usually it's a childhood wound somewhere that we have to look at, an experience in childhood more than this trauma. So critical memory integration gets to our core cells. And it can be fast. It can, I can do it in about 10 minutes or so. And we let them explore. We get curious about the emotion and the sensation in your body. And what I do with my clients is I say, let's just get curious. You're feeling a lot of anxiety in your chest. Let that grow. Let's get curious about that anxiety. Let's see what it looks like. Give it a color. Give it a sound. Give it a taste if you need to. And we let it grow and grow and grow and get bigger. And then we look inside it, right? And if we can look inside at what's inside, usually it's them as children. I'll give you a good example of that one. And then I'll tell you how we work with it. I had a firefighter in here and he was pissed. He was so angry because he had to go do training on how to clear a room that's in a fire, especially with bunk beds. I said, help me understand that. Tears in his eyes. He said, because if someone would have done it right, I wouldn't have had to find the 4-year-old that. And I said, okay. So I started some ART and these two work really well in correlation. And he had this emotion and it kept getting bigger and bigger. And I changed the CMI and I said, okay, let's get inside that anger. As we got inside, he was a little 4-year-old sitting on a bunk bed. And no one came to him when he was sad. And no one helped him. So I said, let's sit with that 4-year-old. As an adult, older, wiser firefighter, sat with the 4-year-old little guy who wanted help and listened to what he has to say to you. And he said, the little boy talked to him. His little younger self talked to him. And his older, wiser self reassured his younger self. And through it all, his little guy quit crying. He said, someone does care about me. And the anger dissipated. It was gone. So he's angry about having to teach how to clear a room because his little 4-year-old self was never helped or held or nurtured. And when he could do that, now it's okay. So
that's incredible.
Critical memory integration, it goes to your core self, the core wounds that make us respond to things the way we do. And it's not scripted. It's a beautiful process.
Yeah. And I think when I love listening to descriptions of these types of modalities, because one of the big problems we have in our society is we've pathologized symptoms. We have created pathology around anxiety, around depression, around, even mania, and it ends curiosity into the source. We stop looking for the source because we believe we've been given an answer when we're given a diagnosis. Bipolar diagnosis, obviously is the focus of this podcast, but people stop looking for answers. And I stopped looking for answers. I spent 12 years in psychiatric treatment on drugs and in and out of hospitals, and therapy was totally useless because I was doing talk therapy. And when you stay in the upper part of your brain, you don't actually ever get to the, I can be super logical and I was an expert on all the issues that I had, but I couldn't fix them. I couldn't resolve them. And when we start looking, I love what you said, looking with curiosity. When we are taught to pathologize these symptoms like anxiety or anger or depression, there is no curiosity, there's judgment. We're judging the emotions and saying that they're bad and we want to suppress them with drugs or, get them to go away. They're a disorder. Something's wrong with our brain. But when we look with curiosity into it, why is our brain reacting that way? What is the source? What's actually causing the brain to react this way? And I love what you're saying about sitting with it and allowing it to grow so that you can get inside of it and find out, where did this come from in the first place? And then you can give the person what they actually need to, and integrate that back in so that they're not getting triggered. One of the things I want to ask you a little bit about this in your experience, it took a long time for me to unwind all of the different symptoms I experienced because everything got lumped into buckets. So anxiety was all lumped into one bucket and depression was all lumped into one bucket, and so it took years for me to parse out symptoms and start seeing them as as separate, the issues that they were and the separate sources that they had, so I started recognizing not all of my anxiety acts the same. No. Some of the anxiety is like my body is not getting the nutrition it needs and things are not behaving. My brain is not behaving the way that it should. Some of it is like trauma responses to things. I have a situation happen and I don't feel safe and my brain goes into fight or flight and my body starts to, my chest gets tight. I can't breathe. And so then, what you're talking about is taking that further and looking inside of it and saying, why do I feel unsafe in this situation? What it is about this situation that makes my brain feel.
Why can't you breathe? Let's get curious about that.
Yeah.
Right. And so then we get curious about that and it takes you back to an instant where you didn't feel safe. The first time your chest was tight and you nurtured that little girl. You, as an older, wiser self, can heal your little girl whose chest was tight and didn't feel safe. But we don't know that we can do that. So one of the things we do is I teach my clients to do that all the time. After we do a CMI session, I'll say, you can do this at home. You can visit your little girl as often as you want to visit her. Anytime you feel a sensation, let's just get curious about it. Ask her about it. And that little girl can be even pre-birth, which was my little girl.
Wow.
My little girl was still in whatever the world. I think it's a pre-existence before we came to this earth. I was conceived out of rape. I didn't want to come. I didn't want to be on this earth. And I never felt like I belonged. And my CMI session took me back and helped me learn to belong. And that was 2 years ago. 2 years ago, I finally felt like I belonged on this earth because I was able to heal what I call my zygote. I gave her permission to be here.
That's incredible.
It was just an amazing experience.
Yeah. One thing that I'm curious about is you said that in your bio, it says that you are working with the CMI team to develop this for groups. What does that look like?
So I run retreats. So that's in my bio too, right? And I love this concept of CMI. I love it. I love the practice. I love the spirituality of it. It's such a spiritual piece to me to be able to explore that with clients. Well, because I run groups, and because I run retreats, I used it at one of the retreats right after I was trained, because we do retreats usually March and September. I was trained in February, went to a retreat in March, and I had 12 women there, and we were working on, I have to remember what that topic of that retreat was because we change the topic every time. Oh, we were working on becoming connected to ourselves, walking with ourselves, right? So I just asked a question of the group. I said, we're going to go into this thing. Here's what I want you to think about. And I always invite them to close their eyes and put their hands on their chest, right? Because this actually gives your body the physiological response of a hug. So you're nurturing yourself, you're hugging yourself. And I asked the group to focus on when they first realized they couldn't walk themselves, right? And it was a little bit more complicated than that, a lot more detail. And all 12 women participated, except for one who said it was too hard. She walked out, which is fine too. It's okay. And we had different emotions. Some people were sobbing. Some people were upset. Some people were not. It was beautiful. And then they came back and shared. But we want to do that more often. Can you imagine that in a group of veterans? Can you imagine that in a group of women who've just been with postpartum?
Yeah.
Right. All of those things. And so my goal is to help that we can, help more people in a smaller, instead of an hour. And CMI can take anywhere from 10 minutes to an hour. It really doesn't have a time limit on it. But can you imagine helping 10, 15 people at one time in that hour instead of one person in that hour? And the healing process that comes with it. And I run it in 3 retreats. And the outcome is beautiful. It's just beautiful. Usually in groups, we let them journal afterwards. Just journal your experience and then share a few more. I remember one girl said on the very first one, she was 17, pregnant, wasn't telling anybody. And it was the first time she allowed that 17-year-old to grieve what her life would have been. Isn't that CMI session?
That's incredible. Yeah. I can't imagine. I actually think that it's really incredible because with my coaching group, there is so much power in the feeling like somebody else understands what you're going through. And, I can imagine, especially the application with veterans, where there's other people, because a lot of times when I do speak with veterans, I actually had somebody on my podcast a couple of weeks ago she's a veteran and ended up in the psychiatric system and just totally traumatized by psychiatric drugs and that. And nobody asked her, like, the things, if you think about what she went through, she was in the first deployment for the Iraq war. There were so many people that were suffering and nobody understood what they were going through. And they just started labeling them with psychiatric disorders and drugging them up.
Yeah.
And we wonder why we have so many veterans who are giving up, and to be able to help them in a setting where they feel like they're not the only one, it's not the only, they're not the only person going through this is really incredible. I can't, that would be an incredibly powerful approach.
And that's why I like group work. So many people feel they're alone, and they're not. Get a group going. I'm running a Gottman group right now with 6 couples, and they're married 4 months to 30 years. and their experience they share, and they realize they're not alone, and they realize that others understand. Well, I love that with I do mental health training in our police departments, right? And to do some of that and help them understand and be able to have a safe place to talk about those experiences and to learn how to deal with it. Group work is powerful, because you're not alone. And it's the first time many people feel like others understand. So then doing CMI in groups, so you're having the same experience that's completely different, but the same. Because it's individual to you, but these other people understand the experience because they're having it.
Yeah. And one of the things that I love about this too, a lot of my initial experience, so the first at least 12 years, maybe 15 years of my experience with therapy, group therapy, and that was terrible.
Yeah.
And I hated it. I didn't, and a lot of it had to do with feeling like we were just all wallowing in our misery together. There was nothing offered that made me feel hope or made me feel like we were going to get out of what we were going through. I felt like we were all just being victims together. And there was one experience that I had where I had been hospitalized and was released into an outpatient program. And I went one day and I refused to go back. I'm like, that's making me worse. I'm not going to do that again. Because I felt more depressed after the group session than I did before I went into it. And I realized that it was the same issue that I was having with therapy, which was talk therapy was staying in the upper part of my brain. And I was not able to access the lower part of my brain where all of the trauma and the anxiety responses and the, depressive responses, all of those emotional responses to the trauma existed. And I would just talk about the problems, which made them bigger. It made them feel worse. It made me feel like I just kept quitting therapy because I'm like, that just makes me feel worse. And I can do that for free with a friend. Like, I don't need to pay somebody for that. And so it took a long time for me to understand that therapy could actually help because I didn't know anything about modalities. And the things that you're talking about they feel revolutionary to me, honestly, because I feel like and I don't know if I don't know if it really is just happening in the last 15 years, maybe, that all of a sudden there's all of these different therapy modalities that are helping us to get to the source of trauma and actually resolve the sources of trauma and helping people actually heal. Whereas in the past, it was just talking about our problems. And I think that there's value in things like cognitive behavioral therapy and dialectical behavioral therapy and that. But if you are not treating the source, I think that you can stay on the surface with those treatment approaches because it's the same kind of thing. We're staying in the upper part of our brains with those often and not able to actually access and resolve the underlying sources. So I feel like there's layers of treatment that need to happen where we resolve all these really tough issues. And I'm excited about the ART and the CMI, as additional therapy modalities for people to look into. And then you can start working on the thought patterns that were created when we, because of the trauma, right?
Yeah. And that's it exactly, right? DBT, CBT, we use them. Right. I'm trained and we use them, but we use them logically. We don't use them emotionally. Right. And they're just symptoms. All those are doing is dealing with the symptoms. If I want to heal the whole person, I don't want to deal with symptoms. And I'm a talk therapist. I can talk with the best of them if that's what they need. Right. Yeah. But I can teach skills with the best of them, but I can't go home with them. I can't make them practice. And so much of that is practice outside of the therapy office, not what we're doing inside.
Right.
Well, ART and CBT and CMI is what we're doing inside the office. And they don't have to practice outside because we've filled the wound. And you still can do CBT. You can still do DBT. You can still do ACT. You can still do all of it. And they're great skills, but they're treating symptoms. They're not treating.
Yeah. And one of the things that I recently started understanding better is, for me, for example, when you have wounding, especially if you have wounding in your childhood, our brain tries to cope with it. It comes up with ways of coping. And some people have very obvious coping mechanisms, like drugs and alcohol, right? But there are things that are not as obvious, negative thought and behavior patterns that are internal that people don't see, but the person is suffering and that's how their brain has learned to cope. We have so many people who are, I had a practitioner on recently that works with people who dissociate, and he was talking about how most of us dissociate in some form or another. Oh, yeah. It's not to the extreme that somebody ends up with a diagnosis of dissociative identity disorder, but when we're scrolling, they call it doom scrolling, or getting lost in binge watching shows and things like that was one of my coping mechanisms for years, and the thought and behavior patterns that develop out of these things. A lot of times you can resolve the underlying issue. So, I talk a lot about, identifying the source. Let's identify what's the actual source of the trauma. What's going on here. Identify that, resolve it. But then you have to create new habits. You have to change the way your brain thinks now because you've spent 40 years thinking this way about yourself because of this, the trauma. Now the trauma's gone, but you have this habit that you've created. So there's that's one of the things I want to talk a little bit more about how your clinic evolved, because one of the things I was talking with, I'm blanking on her name, but she's she's a coach there. Mo, yes. Mm-hmm. So I was talking to her, and one of the things we were talking about is she's a life coach that works in your practice. And she said she might be working with somebody and they discover that there's some things that need to be resolved. So then she can refer them to practitioners in your practice. And I'm like, that is brilliant, because a lot of times people don't understand. Like I said, we pathologize these issues, and so people think they have a disorder and they don't think that there's anything they can do about it. So they're taking medication and they're working with a life coach, but nothing's working because they're working on the surface with all of this stuff. And I love with your practice, and I'd love to hear a little bit more. Like I said, I'll stop talking in just a second, but how you developed your practice and, what the philosophy is there, because you have so many different pieces that are offered in your practice, family therapy, individual therapy, marriage counseling, life coach, that all can work together if you've got practitioners that understand how to start getting to the sources of issues, and how do we create a plan that's going to help somebody not just solve their own issues, but then start working on the system, the family system that has now been harmed by somebody struggling with their mental health. So can you talk about your practice and how you evolved into the practice that you have now?
Well, again, it's such a God thing for me. There is no coincidences in my practice. None. Mm-hmm. I can't tell you how many times there's been someone in crisis and I had a cancellation right the same. I can't. But my biggest thing, and I'll tell you, my biggest thing is I want everybody who walks through my door to feel a sense of safety and peace that they can't feel anywhere else. And an example of that, it was really kind of funny, is when someone calls in and we ask them how they heard about us. That's just part of our intake. And I get DoorDash delivered kind of regularly because I don't have time to do anything else. And this girl said, I delivered the DoorDash 3 months ago, and I thought if I ever needed therapy, I wanted to come to somewhere that made me feel like your practice did. So that is my number one goal. When you walk through my door, I want you to feel a sense of safety and peace. And if my practitioners can't contribute to that, they can't be part of us. Mm-hmm. So I'm very, very prayerful about who I hire. I just have a brand new student who just graduated from school, and I said to Mo last year, I'm not taking any more students. I'm done. I don't want to intern anymore. And then I got this resume, and God said, you're supposed to work with me. I'm like, okay, whatever. So it's such a God journey for me. Okay. When we opened, I just went around to different businesses by us and said, hey, we're here, just letting you know. And I walked into the police department in Linden, Utah, which is a very small police department. And I talked to the chief and I said, hey, we're here. And he said, I believe in therapy. And I believe all our first responders need therapy, and my guys will start coming to see you. Well, right after that happened, George Floyd in Minnesota happened, right? And I had someone approach me who said, my friend and I were talking about it, but we decided instead of talking about George Floyd, we should be about it. And I know you work with first responders. Can we start a nonprofit? And I said, we talked about the dream, and the dream was that all first responders in the state of Utah could receive therapy. So I started a nonprofit, and it was beautiful. And we helped train over 200 therapists in Utah in ART. And we got contracted with all these departments throughout the state of Utah. Well, the nonprofit was so successful that we couldn't fund it anymore. We were spending $60,000 a month in the state of Utah for first responder therapy. And our funders just ran out of money, right? So that kind of started our journey. In that journey, I realized that they needed more. They needed more. I was already trained in ART, but they needed more. And so I still work with a lot of first responders, but someone needs IFS. They need parts work. I'm not an IFS therapist, but Harmony is. And she's also trained in ART and CMO. So all of my therapists have to be trained in ART and CMO. That is required. I don't like to do addiction work. Now, we get it all the time, but Spencer, my new student who just graduated, is very good in addiction work. So I want to be able to heal and not just treat. heal the majority.
Mm-hmm.
I don't want to be able to just talk to them.
Yeah.
And so as they start learning things, we have a women's visual art group. We have an art studio because some people can't talk. There's a sign back there that says, I can say things in color and shape that words will never express. Right? So we do, it's just whatever the need is. I run a boundaries group because someone said, I don't understand them. How do we do boundaries? Okay, let's learn boundaries. Right? So we run a group. But my practitioners all have to be trained in best practices. And then they can branch out from there in what is best practice to them. IFS is great. It's great. I think it's beautiful. I think it's beautiful. Yeah. But that's not where I go. And I want them to have their own personalities and explore their own journeys and find out what works for them after you train in ART and CMI.
Yeah.
I have a practitioner right now who is of active duty military. He's my age. Active duty military, getting ready to retire, who's been all over the world doing therapy for veterans. And now he's worked for the Department of Public Health, which I didn't know was a military department. It is. Helping veterans get occupational therapy and physical therapy and those resources. And then he does therapy. Well, my other veteran who was a captain in Iraq, colonel in Iraq, doesn't want to talk to me about that experience. It'll talk to him. So we have to have that diversity and that breadth of modalities so the needs can get met.
Yeah. Yeah, I was starting to go through and try and make a list. I was going through all of your bios in there, and you have IFS, CBT, DBT, mindfulness-based stress reduction, acceptance, acceptance and commitment therapy, which is ACT, EMDR. So I was just like, this is incredible. All of these modalities in one clinic is really impressive. And I think I told you before we started recording, I'm not saying that there aren't other clinics out there like this, but this is the first one I found. And I've done a lot of research because
I'm sure
not just for myself, but for, I've got people asking me all the time, like, where can I get good therapy? And I want to have good practitioners that I can refer people to. Yeah. And this is like seriously one of the most impressive clinics that I've seen. And I'm not saying that to try and like stroke your ego. It's just really impressive. It's really amazing because most people, when they go seek therapy, don't know what they're doing. I remember when I was sent to go to therapy the first time, I was like, I don't understand why I'm doing this. And I don't understand what I'm supposed to do. And if you get a therapist, and therapists are people, and you can get I shouldn't say bad therapist, but an incompetent therapist.
It's shop for that reason. If I'm not the right therapist, shop.
Yeah.
If I'm not the right therapist for you, let's go help you find one that is.
But people don't know what to look for a lot of times. Like they don't understand the purpose of therapy. They don't understand what to look for. And I was being told that I was going to therapy by, I was told by psychiatrists I needed to go learn coping mechanisms because there was no idea of me healing, especially back in 1998 when I was first diagnosed, right? And every time I would go, it would make me feel awful. And so I just kept quitting. And will be forever grateful that I listened to the last person that was like, please just try one more time. It was my church leader. And I was in crisis at the time. We were really struggling with some pretty big family issues. And I was, asked to try one more time. And I'm like, I will try one more time, but I'm never doing it again if this is the same as it's been every other time. And thankfully, I ended up with a good practitioner she was an EMDR therapist, and it worked wonders when I went with her. And that revived my hope in the industry. And then, but all these different modalities that you have give people options, and they give therapists so many tools to work with to tailor their therapy to the client and help the client. I always say a good therapist is a facilitator, and they are helping you work with, you be in the driver's seat and you work with healing, discovering and identifying and healing your own issues so that we don't feel like helpless. We don't feel like a victim.
That's why I want to teach. That's why I want to teach my clients. You can do this outside. They can even do some eye movement outside to reduce body sensations. I teach them how to do that. Right? When you leave, if you start to feel these body sensations on any other, put your hands about this far apart or look at a window or a picture and move your eyes back and forth for about 30 seconds. Recognize what's happening in your body. Usually takes twice. So be aware of that, sometimes 3 times. But just notice the sensations in your body. Move your eyes back and forth about shoulder movement. I want them to have the skills. If I get fired because they've learned it, great.
Yeah.
Great. I don't want to keep clients for 10, 15 years. Do I have
and there's plenty of
and
there's plenty of people out there that need help. It's not like a therapist needs to keep on to the same clients the whole time. There's lots of people who need help and not enough good therapists to go around, in my opinion.
I agree. I agree. And that's why I want to help facilitate some of the trainings. I want therapists to have these skills to be able to do some of the things. And that's difficult.
So I want to go. Oh, go ahead.
The other thing I think is really important in therapy is a good intake session, right?
Yes.
I remember listening to you and no one asked you about trauma. Well, I don't understand that. I don't understand that because that's part of our intake form. Our intake form, we're asking about your diet. We're asking about your sleep. We're asking you about your trauma. We're asking you about your addictions. We're asking all those questions. And my style, which is different than most, I ask them what they like to do. What are your hobbies? What makes you happy? What things make you mad? And I let them ask me a couple questions because I'm going to ask them 700 questions over the next little while. You can ask me a couple, right?
Yeah.
But because I'm asking you all these hard things.
Yeah.
So it's part of the intake. We have to know those things.
Yeah, and that was one of the things that I loved when I first talked to you. It's why I wanted to interview you on my podcast is there are, again, I keep going back to this, but because we pathologized these symptoms, there's no curiosity into what else happened in your life. That we all we're being asked is what the symptoms are, severity, frequency, history, family history of symptoms, like, family history of psychiatric diagnosis. And there's nobody asked me when I went in for my initial psychiatric visit, nobody asked me about my past. Nobody asked me my story. That's why I ask people to tell me their stories all the time, because there's so many clues in the story. Like when somebody starts, and it doesn't take very long. You don't have to spend hours and hours with somebody usually to find the clues of like, oh, we got to work on this. We got to work on this. Like there's like gigantic red flags. They're like, well, yes, of course you've got these symptoms. Yeah. You've got these things that have happened in your life. This is your normal body's reaction, your brain's reaction to this trauma.
And sometimes I don't even get to the symptoms in my intake. I don't even get to it because that's not most important.
Right.
I've always been told I was depressed. Okay, we'll talk about depression. But that's what it is. We'll talk about depression. That's not the most important.
Yeah. Well, and I had one time when I was talking to somebody and they told me that they were always sad their whole life. She said, from my early childhood, I was just sad. And the way she was saying it was like, I just have always had depression. And so I started asking her some questions and I said, so tell me, you said from your childhood, tell me about your childhood. And as she talked about it, it became very easy to understand why that little girl felt so sad. And I said, did anybody ask you why you felt sad? And she said, well, no, I just had depression. And I said, but why were you sad? And as we talked about it, I said, somebody should have said, and I said her name. I said, why are you sad? Tell me why you're sad and talk to you about, as you talk to me about your childhood, you had a sad childhood. Like, of course you were sad. And nobody ever asked you about it. Nobody ever gave that little girl what she needed. And that's one of the things I loved about what you were saying when you were talking about like the CMI and the ART, that those needs weren't being met. And so your brain is trying to meet the needs in the best way it can. And as we're, in our youth, we don't have the skills necessary to understand what we're dealing with. And so we come up with often very unhealthy ways of coping with things. Right. And then if it's pathologized, then we think we're broken, and we develop this idea of who we are based on, all of these unhealthy things that got built around this trauma or this, the neglect or whatever it was in the childhood that left you feeling, unwell, left your brains, grasping for things to try and care for itself.
Yeah. And so we survive. We survive with the cards we've been given.
Yeah.
And it's not anybody's fault necessarily. Sometimes there is neglect and abuse and things that we can say. You were victimized, but you don't have to be a victim, which is a big thing to me, right? Well, we learn these survival skills. Well, if we have these survival skills or maladaptive coping skills, right, there's a reason underneath it. Yeah. And yes, do I have to keep you safe? Yes. Does your life matter? Yes. If you're suicidal, I will hospitalize you. Straight out. Yeah. Your life is more important to me. Right? But why are you suicidal? Let's talk about that. Let's figure it out. Because that is just your coping skill right now. That's your survival skill. And Why did you have to survive? Why couldn't you just enjoy life and thrive? We have to figure that out.
Yeah.
That's the piece that's more important, because I don't want to hospitalize you.
Right.
Right? I want to help you heal.
Yeah. I know the first time that I started learning about parts work and IFS and that, I was kind of blew my mind, because all of a sudden, all of these things started to make sense. I'm like, oh, so when I was experiencing suicidal ideation for those years that built up to the attempts, my brain was trying to solve the problem and there were no other options left. And so it was like, well, this is the only option we have left. And so so instead of feeling like there's something really wrong with me, it enabled me to start having compassion for myself and recognize like my brain was just trying to help me.
Yeah.
And it was trying to solve the problem, and it had gone through all of the other options and there was nothing left. And so it was like, well, this is the option. So this is what we need to do now. And it was not helping me in a helpful way, but it was trying to help me. And it helped me to have compassion for that part of myself and not feel like there's like, oh, don't tell people that's, normal people don't think things like that. That was a thing that kept me from asking for help for years, was don't tell anybody you're thinking that, because normal people don't think that way,
And yet they do. Everybody has had suicide ideation. Everybody has had thoughts of, I don't want to do this anymore. Life would be easier if I was dead. Right?
Mm-hmm.
Everybody, and if they tell me they haven't, I know they're lying, because everybody has. That is normal. And we can normalize some of that too.
Yeah.
Right?
Yeah.
Now,
and learn how to give your brain
a plan. That's a different. Right?
Yeah.
But everybody has thoughts.
Yeah. And learning how to give your brain what it's asking for. Like learning how to listen in a way that with curiosity and think, okay, that's not healthy, but there's something going on that's making my brain reach out in an unhealthy way, So, oh man, this is so amazing. So when somebody comes to your clinic, how do you decide like how, who's going to treat them? Is there like a method to that, or do they?
Yes and no.
Okay.
My schedule's very full, and I only do word of mouth referrals. Mm-hmm. So if they can't wait for my schedule and we know what their need is, we get a little bit of what their need is, that will decide. And again, it's a God thing for us. It is. Mm-hmm. Like, I'll read their intake, because every intake goes through me before they're assigned. And I'll read their intake and I'll say, oh, this person needs Jen.
Mm-hmm.
Right? Not everybody likes to do couples work. Jen and I will do couples work. So that kind of narrows that down. But it really is prayerful to me. And Mo is a rock star like that. She's very prayerful about things too. So she'll say, Janey, here's this intake, and I think they should go to this person. And I trust her, and I know that's, so it really is just, if they ask for someone directly, we get them into that person directly. If they come in with specific things, whoever fits that need the best, but it's also where they're supposed to be.
Mm-hmm. Can I ask you about boundaries? I've talked about it on my podcast myself. And I do think there are a lot of people who don't really understand what boundaries are.
They don't.
It's something that is like, especially when if you've got, especially in like marriages and in family systems, if you've got at least one person in that family system that is struggling with mental health, and even more, especially if they have been diagnosed with, any kind of psychiatric condition, you end up with unhealthy boundaries just by default. Like there's just no way to, it's almost like people don't think that it's possible to have healthy boundaries in those situations because that person is sick and they can't help themselves, right? And so then you end up with like all these unhealthy dynamics. And so I talk about how critical healthy boundaries are in order to actually, heal and recover. So would you mind talking a little bit about like how you describe boundaries to people and what that looks like, so people understand? Because I think there's so much talk online about boundaries and not all of it accurate. And so people don't have an understanding of what a boundary is. I didn't. I finally admitted it to my therapist at one point. Like, she kept talking about boundaries and I'm like, okay, so I don't actually understand what boundaries are. Can you tell me what you're talking about, please? So would you mind sharing like what you share with people?
So the two things I talk about is internal and external boundaries, right? Internal boundaries are where I end and you begin. So let's say my husband comes up and he starts yelling at me because I forgot to turn off the light. Well, I have to look at myself. Did I create that problem? Did I contribute to his anger? And the answer is no. I didn't have to make him angry. Did I forget to turn out the light? Probably. But he chose the anger. So I don't have to respond to that. I can say, oh, I'm sorry I didn't turn out the light. But I don't have to react to his anger because I didn't create it. Does that make sense? That's an internal boundary. I end here, you begin there. And if I didn't step into your beginning, that's not mine. But external boundaries are, this is mine. This is what I'm going to do. A rule is what I expect from someone else. And most people think boundaries are rules. You cannot speak to me that way. That's a rule. And I have no power over anybody else. I only have power over Jade. My boundary is, if I'm spoken to disrespectfully, I will leave the situation. And two things I don't tolerate. I don't tolerate dishonesty. I don't tolerate disrespect. My boundaries are very tight around this, right? So if it's someone I care about, I'll say, I would love to have that conversation with you when the tone is more respectful. Until then, we're going to disengage from it. I will disengage from this conversation. If it's someone I don't have a good relationship with, I don't know, I just leave the situation. My boundary is, I won't be in a conversation of disrespect. I can't tell you not to disrespect me. I can't walk with a sign on my chest saying, don't disrespect me. But if I feel disrespected, I can handle it myself. So a boundary is personal to me. It's not a rule for someone else. And I teach people that all the time. And then we start practicing simple boundaries, right?
Yeah.
Not all boundaries have to be shared, which is unheard of for most people. I have to tell them what I'm going to do. Actually, you don't. Now, in a partnership, a marriage, that type of relationship, some of my boundaries will be shared with my spouse. But not everything. Not all boundaries, because they're so personal to me. I don't have to tell everybody my boundary. And that's where people get caught, because they think it's a rule and I have to share the rules. You're right. Rules have to be spoken, but you can't force them. Boundaries are yours. They're nobody else's. They're mine. Mine to set, mine to hold, mine to be consistent.
Yeah. And personal accountability, that's one of the things I'm always talking about, like, this is your responsibility. This is his responsibility. You have to stop trying to like fix each other and stop trying to get into each other's business, because it's not going to help. First of all, you cannot fix another person, and it can create resentment. It can create, it creates distrust. There's all these issues that are created when we try to get into, like cross into each other's territory and start trying to fix the other person and change the other person. And that's one thing that I see all the time. And I wanted to ask you, just out of curiosity, do you have people that will come to you for marriage counseling, for example, and as you're working with them, recognize we probably should do some individual work? Like, does that happen often, and vice versa? Like, when you've got somebody that coming into you for individual therapy, do you ever suggest, like, I think it would be a good idea if you and your spouse came in for couples counseling? Like, is that something that you guys do in your clinic?
All the time.
Yeah.
And then they'll say, well, will you see us for individual and for couples? And I said, it will depend. Because I don't mind doing that. Some therapists absolutely cannot separate that. I can't. But it will depend. It will depend on my schedule. It will depend on your schedule. It will depend on the need, right? It depends. But yes, all the time people come in individual and they really need relationship work. And then they'll come in for relationship work and they've got their own childhood cultures and traumas that have come in that they have to heal before the relationship will work. So it just depends. But yes, we do that all the time.
Yeah. Okay. And then my last question for you. Well, I've got two questions. I'm going to give you a heads up on the final question. So the final question is always like, what's your one parting piece of advice that you would like somebody to take away? But before I ask you that, so I'm going to give you a second to kind of think about that. But what would you recommend to somebody who has had bad experiences, say, like I did with therapy, that is like listening to this and thinking, oh, maybe I could try it again? What would you recommend to them? Like, how would you recommend they approach looking for a good practitioner? Do you have resources you could recommend, or do you have any ideas for them for how they can research modalities? Because I think that's one of the things that people struggle with, is they don't understand any of these treatment modalities. And so that creates a barrier for them, knowing what to look for in a therapist.
I do think that's really important. I have to step in that world a little bit because I know treatment modalities. I know where to research and how to look, right?
Yeah,
but I do recommend a lot of people when they say, I have trauma experiences. Okay, have you looked into ART, or have you looked into CMI, or have you looked? So we say that a lot on our intakes because that helps us assign a therapist too. But just start looking best practice for trauma. Like ART is recognized by the Veterans Administration as best practice, by Department of Defense, and by NAMI, best practice for PTSD, right? Ketamine, best practice for PTSD and treatment-resistant depression, which we also have in our clinic. We have a ketamine clinic, the on-staff doctor, right? So finding out what do I think I'm struggling with and what helps, and just go on. AI, there's great things about it, horrible things about it. They are not a therapist, even though that's the number one reason people use AI. But what is the best practice for being a victim of sexual assault? Ask them. They'll tell you where to look and how to look.
Mm-hmm.
Don't use them as a therapist, though. They are not a good therapist.
Awesome. And then what is the one thing that you hope somebody will take away from our conversation? What's the number one thing that you're hoping somebody will take away?
I think the number one thing is you are not broken. No matter what you've been told, no matter how you feel, you are not broken. And you can heal. You can heal. And I think that's most important. I don't see anybody as broken. And they come in and tell me they are all the time, and they're not. They're not. They've had some hard experiences. They're not.
That's fantastic. All right. Where can people find you if they want to connect with you?
Oh, our website, www.healthierucc.com. I have to think about that. Or they can just call us. It's 801-701-0348.
Wonderful. I'll make sure all of your links are in the show notes so people can find you there.
Great.
Thank you so much. This has been a fantastic conversation. I'm actually super curious now to look into these things, these modalities more, because especially the CMI, like I just had never, when I was reading through your bio, I'm like, what is that? And I was like typing it in, looking it up. And so I'm very excited to learn more about these things. And thank you so much for sharing what you have and for everything you're doing. It's just really inspiring. Thank you.
Thanks. Thanks for having me on. It's been fun.
Absolutely. All right. Until next time, Upsiders.